For the third day in a row, the U.S. topped its all-time coronavirus record on Friday. New cases in a single day have topped 150,000. More than 67,000 Americans are hospitalized, and all 50 states are reporting a rise in numbers. President Trump spoke for the first time Friday since President-elect Joe Biden was declared the presumptive winner of the 2020 election. He denied that his administration would propose a national lockdown, but Mr. Trump claimed a vaccine would be available for vulnerable populations in a matter of weeks. Mr. Trump still has not conceded the election. Nikki Batiste kicks off our coverage from New York City.
The pandemic not just getting worse, but raging throughout the nation. For the first time, all 50 states seeing a rise in daily coronavirus cases, according to CBS News analysis. Governors across the country practically begging residents to follow health safety guidelines.
It's a very dangerous situation, and our hospitals have been sounding the alarm.
In New Mexico, the governor ordering all non-essential businesses to close for the next 2 weeks. Residents ordered to shelter in place. Tonight, this stark warning from Idaho's governor.
We are in the middle of an unprecedented and dangerous time in our state's history.
Colorado again shattering records for new cases and hospitalizations.
These are our darkest days as a nation. They are our darkest days as a state.
In New York, the positivity rate on the brink of the 3% threshold that would trigger the closing of all public schools to in-person learning. The city's mayor with this message for parents.
Have an alternative plan for beginning as early as Monday.
California now passing an unsettling threshold. More than 1 million COVID cases, the second state to do so after Texas. In hard-hit El Paso, a city with more hospitalizations per capita than any single state in the country. The healthcare system is overwhelmed. Nurse Lawana Rivers posted this after finishing a shift.
There's not a single patient that made it. Y'all, when I say this assignment here, like literally almost destroyed me.
In Minnesota, health officials want all 18 to 35-year-olds to get tested. They're seeing disproportionate spread among young people. 17-year-old Minneapolis resident Ella Winston was hospitalized 10 days and just got home.
Being in the hospital was so scary. Just seeing my mom so sad too, it was really hard for me.
Based off what you are going through, does that change your mind on how you think about your own Thanksgiving plans?
I think our family's going to have a small, tight, knit Thanksgiving for ourselves and probably some Zoom calls. It puts a perspective of how fragile life is and what we're thankful for.
The restrictions taking effect here in New York City tonight include a 10 p.m. curfew for restaurants and gyms and limiting gatherings in private homes to 10 people. But the governor warns tighter restrictions are looming. Lana?
Thank you, Nikki. We now turn to the COVID-19 crisis in Europe. Italy surpassed 1 million coronavirus cases this week. The country was one of the hardest hit by the virus. CBS News has received rare access into a hospital there, and shocking footage is revealing the realities of the country's overrun health system. Chris Livesay has more from Rome, but I need to give you all a warning that some of the images you are about to see can be graphic.
Inside a Naples ER, a man collapsed on the bathroom floor. This one is dead, says the person filming. This one, we don't know whether he's alive or dead. Even ICUs struggle as the body count soars, something we witnessed up close in Rome.
So this is a patient who just passed away from COVID-19. Just this moment, proprio in questo istante è morto. So just 2 or 3 minutes ago, this patient was alive and now he's passed away.
Unfortunately, it happens, says Dr. Sebastiano Petrarca, more and more often as infections surge across Italy, once the worst hit country at the start of the global pandemic.
Italy was the first country in the world to lock down nationally so that this would never have to happen again.
But Italians eventually dropped their guard, says Dr. Petrarca, who's now running out of ICU beds. Rome's COVID hospitals are saturated, he says. It's exploding again. Chris Livesay, CBS News, Rome.
For more, let's bring in Dr. Amesh Adalja. He's an expert on infectious diseases and a senior scholar at Johns Hopkins University Bloomberg School of Public Health. Doctor, first of all, seeing these reports and the work that healthcare providers are doing, before even giving you a question, I just want to start off by thanking you and all frontline workers for what you're doing.
You're welcome. Thank you.
So the big hope today is, of course, the vaccine. At Friday's press conference at the White House, President Trump said a coronavirus vaccine will be widely available, quote, as soon as April. We are all, of course, hoping that this is true. Given your experience, do you find this timeline realistic?
I think it's in the realm of possibility, but we have to be prepared for there to be hiccups when we start to produce a vaccine, which we still don't have an approval yet for a vaccine or safety data.
Well, earlier this week,
trying to make 600 million Americans two-dose vaccine, and it's also something that needs to be put into cold storage that is very difficult to do logistically.
Yeah, we're learning so much more about that cold storage, and it's not just cold, it's extremely cold storage. Earlier this week, drug maker Pfizer said that its coronavirus vaccine is more than 90% effective. You wrote about this in a piece for The Hill, arguing that the enthusiasm it generated should be, quote, tempered to some degree. Got to be honest with you, we really want to hope, so why do we need to temper it?
We need to temper it because, just for the first question you asked me, that this isn't something that we have at hand right now. You can't go to a drugstore and get vaccinated. This is a long process to turn a vaccine into a vaccination. And if we don't get this distribution right, if there are hiccups in getting this into the arms of Americans, we're not going to be safe from this virus. And you have to remember that we don't want people to get this false sense of security, that now that a vaccine has been made, that all of a sudden they can let their guard down, that they don't have to do anything for these next couple of months because there is a light at the end of the tunnel. While there is a light at the end of the tunnel, we're still in the tunnel, and many people are going to die between now and when that vaccine is available, and many hospitals may be pushed to the brink before that vaccine is available. So we cannot let up. We have to continue to be vigilant about this virus until that vaccine becomes a true reality for all of us.
Well, you also touched on what you call the Herculean vaccine distribution task that lies ahead. What do you believe will be the biggest obstacle when it comes to successful distribution of any coronavirus vaccine? We know that there are several different ones that are currently in development. And I'm also curious what impact might delaying transition access mean to people who are waiting and counting on that vaccine?
To me, the biggest obstacle there are two. One is that this, like we alluded to earlier, this needs to be kept at very cold temperatures, minus 70, minus 80 degrees centigrade. Most hospitals, most places around this country don't have that kind of storage. So we have to figure out how we're going to keep this vaccine cold enough so that it remains viable before it gets into the arms of Americans. So that's going to be a really hard challenge. The other thing is it takes 2 doses. So we have to make sure people actually come back for their second dose. Anytime we increase the number of doses of a vaccine, it usually decreases compliance. And I do think it's very critical right now that the Trump administration work with President Biden's team to actually be able to hand this off seamlessly, because we don't want any kind of hiccup. We don't want any kind of disruption. We don't want to lose any time, because people's lives, time is people's lives. So we have to really make sure that there is nothing falls through the cracks, and that these transition teams for the COVID task force transition team work seamlessly, that there is an easy handoff between them so that we can really get this vaccine as soon as possible.
Well, Doctor, you recently said that the first thing you want President-elect Joe Biden to do with regards to fighting the virus when he takes office is to, quote, restore the CDC back to the driver's seat. What do you mean by this, and what kind of strategy do you think is necessary to now get a handle on this virus?
So back in February, basically the CDC became handcuffed. They became gagged. They were unable to talk to the American public on a daily basis about how to think about this pandemic, what actions were safe, which actions weren't safe, what to expect. All of that basically disappeared. And even after that, when the CDC would issue guidance, it was always second guessed, because there was so much political meddling into the CDC process that the stature of this once great institution got diminished because of what the Trump administration did to it. So the first thing we need to do is restore the CDC back to that position where people listen to them, where people know that the data that they're providing, the guidance that they're providing is evidence-based and it is the best in the world. That's what we need to do, because that will coordinate all the 50 states' responses. All the calamity that we've seen would likely become much, much minimized if the CDC was able to speak. And I do think that right now we've got a train that's going hundreds of miles an hour. It's going to be very hard to stop this number of cases that we're having. But I do think if we can get the CDC, if we can get individuals to start realizing that we're in a pandemic and that the actions that we take will have an influence on the number of cases and whether or not your community hospital goes into crisis, I think we can hopefully avert the worst of this. It's going to be bad and it's going to be hard, but I do think that we can take targeted public health actions, a lot of public health communication, and hopefully get some handle on the number of cases so we don't put hospitals over the brink that they're at right now.
Well, I think the thing that is going to be very hard for many people, less than 2 weeks away, is Thanksgiving. Dr. Anthony Fauci has previously discouraged Americans from getting together with anyone outside of their immediate family. On Friday, he joined CBS This Morning and was asked whether it's recommended to wear masks indoors. Here's some of what he had to say.
Now, obviously, it's kind of difficult to be eating and drinking at a dinner with a mask on. You can't do that. But to the extent that you can keep that mask on, I mean, nothing is going to be perfect in this. But if you're indoors and gathering with people, even if it's a relatively small group, to the extent possible, keep the mask on even if you are indoors. People who say wearing a mask indoors, they're really talking about when you get into a setting where you're really unsure what the status of people are. But when families go the extra mile of either quarantining or getting tested, then I don't think you really have to say every moment you're in the house you have to have a risk. You've got to use some common sense and make sure you look at what relative risks are, because the relative risk is going to go way down if everyone's been tested or people have been quarantined.
Dr. Adalja, I'm wondering what your take is on this. Different people have different common sense guidelines. And what is your recommendation for how we ought to be balancing both our desire to have festive holidays surrounded by friends and family, even those that are closest to us, even if they're not necessarily in our house every day, with the need to try and tamp down these spikes that we're seeing in the pandemic?
I do agree with everything that Dr. Fauci said there. I think this is what we have to get good at, this relative risk valuation, thinking about how you can make things safer. And I do think when it comes to Thanksgiving, there are ways to do this. Keep the size as low as you can. If you are inviting people that you haven't mixed with, try and have people kind of segregated a little bit at the dinner and wear masks if you haven't mixed with them, or come up with a protocol if testing is available in your area to test people before they come. The other thing you can also do is have people start to quarantine now, reduce the number of contacts so you can decrease the risk. I think we have to move to what I call a harm reduction approach here, and this is borrowing from other parts of public health, where we know that people are going to take risks. They're going to make choices that maybe not everybody agrees with. So we've got to give people the tools to be able to make these choices in a better way so that they're not letting the virus really take advantage of their activity. So this is what we have to move to, a sustainable approach where we're trying to give people a toolkit that they can use, and at the same time fortifying public health to be able to test, trace, and isolate. I mean, that's the way countries like Taiwan did it. Well, we've been unable to do that from the very beginning, and I think we have to move to that because this has gone on for too long, and there's really no end in sight. And I think that it's only going to get worse in the winter if people continue to behave the way they have.
All right, I'm writing down: isolate now, get tested, minimize risk. Dr. Amesh Adalja, thank you.
Thank you.